Hello, everyone. The government should never be the arbiter of truth. That's why I always get a little nervous when I hear government leaders or media outlets talking about misinformation. But there actually is a powerful national movement that is spreading dangerous and harmful misinformation. It's the abortion industry. And that's why I'm so excited for our conversation today with Dr. Ingrid Skop. You don't want to miss it.
Here at Christians Engage, we are on a quest to see every American Christian take stewardship of their life, their nation, and this generation. Can you imagine a world where every Christian in this country did three simple things? Pray, vote, and engage. And what if we did those ongoing? It would totally shift our nation. That's what we're doing here at Christians Engaged. Over the last 5 years, we've built a standing army of Christians that are saying, I want to pray, vote, and engage ongoing and be leaders in my community. We're just getting started, folks. Here at Conversations with Christians Engaged, join us every week as we take you in depth in interviews with government officials, ministry leaders, subject leader experts, to awaken and empower you to do those three things ongoing. I'm Bunny Pounds. I'm the president and founder of Christians Engaged. I spent 16 years in political consulting working for members of Congress and other candidates before starting this ministry. And my co-host, Ben Quine, our biblical worldview expert and our vice president. Come on a journey with us every week. We're here to help you pray, vote, and engage.
Hello, everyone, and welcome to Conversations with Christians Engaged. I'm Ben Quine, and I'm so excited that you have joined us today. We're going to have an incredible conversation. In 1973, the United States Supreme Court issued the controversial and shocking decision that legalized abortion across America. And since that time, over 65 million precious unborn children have lost their lives due to abortion. Even though the Roe decision was overturned in 2022 in the Dobbs case, abortion is still legal in 36 states and the District of Columbia. And in 2023, the Guttmacher Institute estimated that 1,037,000 children were aborted in the U.S. healthcare system, which was the largest number in over a decade. And that was a year after Dobbs. So there's so much more to be done, so much work that Christians should do as we get engaged to make a difference. And that's why I'm so excited to welcome Dr. Ingrid Skop today to be with us. Dr. Skop, thank you for joining us.
Thanks, Ben. I'm so glad to be here to talk about this critical issue.
Wonderful. Well, you have an incredible resume. You're an OBGYN doctor. You've delivered over 5,000 healthy children. You've cared for countless women who have been injured through abortion. You're a prolific speaker and leader. You're vice president and director of medical affairs for the Charlotte Lozier Institute. And you've just done so much. ABC News even called you the public face of the pro-life movement. That's quite an epithet there.
I've been called worse.
Well, we're just so glad that you're here. And I wonder if you would start off by just sharing a little bit about your story, your background, how you came to know the Lord, how you got into this movement, and how you became a pro-life advocate.
Yes, absolutely. I was blessed to be born into a pro-life family. And in fact, my father and mother, although not married, in medical school for my father, became pregnant with me. So even though it was prior to Roe, it was an opportunity for them to make that decision. Where are we going to go with this? They chose life. I'm so happy they did. And I am the oldest of 6 children. There are now 21 grandchildren. My family have been richly blessed by my parents' choice. So, you know, as a Christian in a pro-life family, I was pro-life from a very young age, but as an obstetrician, I began to see a different side of things. Of course, everyone knows, it's scientifically undeniable that every successful abortion ends the life of an unborn human. So this is a human rights issue that we should be addressing from that perspective. But so many times it hurt the mom too. And so over my 30-year career, I've cared for so many women with emotional, mental health complications, often physical complications, which happen much more often than the abortion industry is willing to admit. And so I speak out on behalf of both of my patients, the unborn child whose life ends and the mother who's so often harmed.
Yeah, that's so right. And in the Bible, we see again and again the Lord commands us to look out for the widows and the orphan, those who are helpless or powerless, those who don't have a voice. And we know that God cares so deeply about every life, that they're precious in His sight. Being pro-life really isn't optional for Christians. Can you give us just the Christian, lay out the argument for life for Christians
Yes,
for us?
absolutely. So, again, anyone with a rudimentary knowledge of the Bible should recognize that the Bible is not ambiguous about abortion. And yet, Barna recently told us that approximately half of Christians do believe that the Bible does not address it. But beginning in Genesis, God tells us He made man in His own image. And then in Job and in Psalm, the poetry describes how He lovingly crafted the unborn. He cares deeply about the unborn. And of course, Christians should too. And on we see Jeremiah, Isaiah, God called them to their ministries from before birth.
Yes.
So clearly, the human being is beloved by God while in the mother, and we should feel the same way. As you say, we should rescue those being led to slaughter. So every Christian should not just have a personal pro-life view, they should actively and vocally endorse a pro-life view. And if they were, I think our country would be having a much different conversation.
Right. That's really key, not just believing it, but actually acting on it. And I think that's what Proverbs 31 really gets at when it says, open your mouth for the mute, for the rights of all who are destitute. Open your mouth, judge righteously, defend the rights of the poor and needy. So it's not something that we just hold intellectually, but we're actually speaking out on behalf of those who can't speak for themselves.
Absolutely.
Yeah. So you touched on this earlier, but I want to go back. There are really two kind of great lies associated with abortion. The first is that the unborn child is not a person. And then the second would be that abortion is good for women. So I know you touched on those already. Elaborate on those for us.
Yeah,
if you would.
absolutely. And I believe that there are many people of goodwill who have not researched the issue. And I don't blame them in a way, because Google is not pro-life. Even if you think I'm going to find out what's going on, it'll steer you to abortion industry data. And just as an aside, nothing about abortion data in our country is mandatorily collected. We don't know the numbers, we don't know the complications, and we certainly don't know that the women who die subsequent to an abortion. So, as you said, the conversation has changed from the scientific reality that this is a human being, and anybody can get on YouTube and look at videos and fetoscopy and pictures of these children who are very clearly identifiably human at a young gestational age. So you really have to be intentionally blind not to recognize that. But the conversation in Roe changed to, well, they're not persons. Personhood has no definition. If we use the ability to have self-reflection, many born people do not have that. Infants do not have that. So that becomes a very slippery slope if we say personhood is required. But then the conversation then comes to, well, women need it. And so the woman somehow has more value than her child. But I think 50 years of widespread abortion under Roe has shown us it has harmed women far more than it has helped them. The incidence of single motherhood has gone up to 40%. In some critically affected populations, like the Black population, it is 70%. These are single mothers, often living in poverty, raising fatherless children. And I think we all can recognize the societal implication of all of that. So it hasn't helped women. It hasn't helped society. And so we need to recognize that. We need to revisit the conversation and say, how do we really help women? This is a very inadequate solution to the complex problems that women face, and we can do so much better. And we are beginning to do better in so many of the pro-life states.
You make so many great points there. One I want to touch on is that Margaret Sanger, who was the founder of Planned Parenthood, she was overtly racist and spoke about how she wanted to harm Black people. So, it's tragic, but not entirely surprising that we have these numbers where so many Black families are harmed by abortion, because that was part of the original intent.
Yeah, I'm sad to say that there is still very much a eugenic and a population control motivation. We see elite thought leaders saying these women should not have children. And sadly, the maternal mortality is something that we really is on the minds of so many people today, because the United States has the worst maternal mortality in the developed world. We have the most money dedicated to healthcare. We have amazing doctors, amazing technology. Why is that? We've been offering abortion as a solution to high-risk populations for 50 years, rather than addressing the true reasons that they suffer maternal mortality. And sadly, unfortunately, that has been the case for Black women. They are being told, we can't protect your life. If you choose to have this child, you need to have an abortion instead, which is tragic.
It's absolutely tragic, the loss of life. Every one of those lives is precious. And you mentioned a couple times now this idea that, even if you look on Google, you're not going to find the truth, and we don't have these statistics. So there's a lot of misinformation that's, I think, intentionally propagated by the abortion industry. And I've got a list of about 5 things. I'd love to just kind of read them off and get your response to these really common but so harmful lies that are out there. The first would be that the Dobbs decision prevents pregnant women from getting the medical treatment they need in emergency cases. We've seen that in political advertisements. We see it all over the place. How do you respond to that?
Yeah, after the overturn of Roe v. Wade, what we saw is an intentional misinformation, disinformation campaign and fear mongering. And this is the crux of it. And I'm sad to say that they were willing to see women hurt in order to make an argument for continuing to provide abortion in every situation. Every single state that has a pro-life law, and I've looked at all of the laws, has an exception that permits an abortion if a doctor, in his reasonable or good faith medical judgment, it means using his clinical skills, feels that he needs to end that pregnancy in order to protect a woman's life or to prevent substantial impairment of a bodily function, the kidneys, the lungs, etc. And it's important, I think, to back up and recognize that about 90% of obstetricians do not and have never done elective abortions. And yet we've all been willing to intervene to protect a mother's life. I did it before Dobbs. I do it now. Nothing has changed in my practice, and nothing should have changed in any doctor's practice, except they have not been given guidance on the law by the pro-abortion medical organizations who've sat back and have been willing to see this confusion persist. And they become fearful. And so that's something that requires education, but it does not require changing the laws.
Right. The protections for the mothers are already built into the pro-life laws, and the doctors are ready to carry that out. But to intentionally create fear, we're told the opposite.
Yes. Yeah. The intent is to destroy the pro-life laws, to turn the American people, doctors and women, pregnant women, against the laws.
Right. What about this one? Abortion is safer than childbirth.
Well, again, I told you that there is nothing about abortion data that is mandatorily collected. There was a study about a dozen years ago published by a very vocal pro-abortion advocate where he counted the deaths the CDC reported from all maternal mortality, which actually included abortions, and then compared it to the data just from abortions. But it turns out that really, of the 3 things being counted, the only thing that we knew with any certainty was how many live births occurred. We don't even know how many pregnancies occur. So very, very poor data. But I would say, to counter that, when we look at better data in European countries, we see that a woman is 2 to 4 times as likely to die in the year following an abortion than following childbirth. She's about 6 times as likely to suffer a mental health death. Suicide, substance overdose. So, and up to a year is the definition of maternal mortality. So when we look at good data, it is the opposite that is true. And again, that's just a fear-mongering statement to convince women to end their pregnancies.
Okay, so you mentioned this a couple times about the data. Why do we not collect that data here in the United States?
Well, there are some logistical reasons that it's difficult. Most abortions are paid for privately. Because there are some legal restrictions on what insurance can cover. And many women don't want to talk about their abortions. Even if they suffer a complication and go to the emergency room, we've documented that more than half of them don't tell the doctor it was an abortion. They lead them to believe it was a miscarriage that caused their complication. So we just can't link the data In Europe, they can link the data because they have single payer healthcare that pays for the abortions. That's why their data is so much better. But going forward, I'm optimistic. I think our new government and our new Secretary of HHS are interested in this question. And so we're going to find, I hope, better data soon. And I think it's going to back up what I've been saying, that it's much more harmful to women than we have been told.
So you just uncovered another real tragedy, which is that after a woman goes through this painful ordeal and they're experiencing trauma, sometimes they're afraid to speak out. They don't know where to look for help. They're afraid to ask for help. And yet help is available in so many ways and places, correct?
Yeah, absolutely. We have got almost 3,000 pregnancy centers in our country. So it is true that people who have suffered the pain of abortion, and so many times these lovely Christians say, what can I do to keep another woman from going through what I've gone through? So these are the people who fund and staff the pregnancy centers. Their sole goal is to walk alongside women, to provide whatever the support that they need in order to give birth to their child. And we published a survey recently that documented that 60% of women with history of abortion would have preferred to give birth if they'd only had more support. And many of the pro-life states are putting state funds to alternative to abortion programs. I'm optimistic what we're going to see. Our country is doing a big experiment. We've got about half the states, no limitations on abortions, others that are trying to protect babies and women. And I think we're going to see that the states that are trying to protect the women and babies are going to see their outcomes improve.
Yes. The crisis pregnancy centers, the pregnancy resource centers, this is such a huge opportunity for Christians to pour into and love our neighbors. And yet, of course, the abortion industry is trying with every ounce of their power to keep it a secret, right? Because it's such a great, tool of love to these women.
Right. They've proven themselves not pro-choice because they don't want women to have the choice to continue their pregnancy. When women have taken the abortion drug mifepristone and have immediately regretted it, which happens a lot because these drugs are being mailed to women, they're being told to put them in their medicine cabinet in case they need it. And I've talked to women who've had a fight with their boyfriend, taking the pill, and then like, no, I didn't want to do that. So a lot of women look to reverse the process, which can be done scientifically with progesterone. But all abortion advocates, all pro-abortion medical organizations have said this is contrary to science. So they don't want these women to save their babies.
Right.
But these pregnancy centers are doing it. They're walking alongside it. It's beautiful. There's one in every community. So everyone who's watching this should find out who their pregnancy center is and should support them.
Right. There's one near you, wherever you are.
Absolutely.
Okay, another misinformation lie that's out there is pro-life states don't allow treatment for miscarriages.
It has become insane what is happening. These are laws that protect unborn life. These laws obviously have nothing to say about a life that has tragically ended. That's a miscarriage. Right. And they've tried to confuse by pointing out that the same procedure that can remove a living child with the intent of killing him can be used to remove a child that is deceased. But of course, the intent is different. Every law talks about intent. We know the intent is to end that life, and no doctor should be confused about that. Even in a rare circumstance where a miscarriage is ongoing and the child is still living, doctors, again, because the law allows them to intervene to protect the life of the mother, doctors know you don't wait and let that mother get sick and become septic and possibly die. If the miscarriage is inevitably occurring, you help that woman complete that process. There should be no confusing about that.
Absolutely. How about this one? Pro-life laws are to blame for the deaths of Amber Thurman and Candy Miller in Georgia.
Well, these are interesting. So these are extremely pro-abortion journalists at ProPublica that have put out now, I believe, about 6 articles, somehow pointing to bad outcomes in women, trying to make the point that somehow the pro-life laws are the fault. Both of the women who died in Georgia suffered complications of the abortion drugs. The drugs killed them. So, and again, in both of those women's cases, the children had already passed, and the doctor was empowered and, of course, should have intervened to remove the tissue to complete it so that they didn't continue to suffer complications. In one of the cases, the woman did not go to the hospital at all. She was found dead at home, which may mean that all of this fear-mongering and lying could have killed her. She may have been afraid to seek medical care when, of course, that care would have been legal. No
Exactly.
woman has been prosecuted for obtaining an abortion. And by the way, going back to the fear of the doctors, no doctor has been prosecuted for performing an abortion to save the life of the mother. So it's just not happening, and yet the fear mongering is trying to imply that it is.
It is. And these sayings are all across the internet, all across the country. Last one. Hospitals are closing because of pro-life laws.
You know, I'm in Texas where there are a lot of rural areas, and rural healthcare and maternity deserts have been a problem for dozens of years. There's nothing new here. But what has happened is instead of addressing real solutions, increasing funding for these hospitals, having high quality transfer protocols so we can get sick women into a higher level hospital quickly, those type of things. Now, again, the narrative is trying to imply that somehow it's the pro-life laws. They're trying to imply that doctors are leaving pro-life states, but we don't even see that to be the case. Again, 90% of obstetricians don't do abortions. Our care has not changed. But when you look at why are these labor and deliveries having financial problems, they're not delivering babies. Killing more babies, ending more pregnancies isn't going to help that, but protecting these babies may help them by giving them more business. So it's counterintuitive, but again, people just need to look below the surface and ask questions when they hear these deceptive narratives.
Exactly. There's so many tactics from these kinds of narratives to redefining the language, or using terms like reproductive rights or reproductive freedom, gender affirming care, all these things that are making something that's evil sound good, right?
Right. That's all they've got is euphemisms. If they called it like it was, then people would see the reality and would not be supportive.
Yeah, exactly. So what's your advice to Christians? How do we get engaged? How do we make a difference post-Dobbs?
I believe if the church were more engaged, and this should start with our pastors. And I'm not blaming our pastors because I think that they probably are also uneducated on the issue. They don't feel confident bringing it up. And it has been painted as a political issue when it should not be. It's a human rights issue. It's a health issue for women. It's so much more than political. But everyone should educate themselves as well as possible about what's really going on. At Lozier Institute, where I work, we have a lot of papers on all of these topics. So they really can find good data. Pastors need to lovingly address the issue from the pulpit because 1 out of 7 weekly churchgoers has an abortion in their history. So some of these people have achieved forgiveness and restitution, but others have not. They've probably hidden it. They rarely think about it. But all of these people need to be brought back into fellowship with Christ and forgiveness. And so we can start there by addressing it in our churches. And again, doing what we can to support the women who are currently in crisis. But even so, we can back up more. Why are so many women seeking abortion? Because they've been told that promiscuous sexuality is just fine and has no repercussions. So let's talk about God's plan for sexuality. Let's talk about God's plan for marriage. The church needs to go back to biblical issues, square one. And if we did that without apology, we'd be having a different conversation. And I think our country's ready for this. I think they recognize that what they've been doing and what they've been told hasn't worked out well. So
I love that. Teaching the biblical worldview, teaching what the Bible says on the issues, that's paramount. And, you mentioned earlier this idea that Christians, even some Christians, think that abortion's acceptable, policy. We talk a lot about how there's 51% of Americans who think they have a biblical worldview, but really only about 6 or 4% actually do, because we're not really reading the Bible. We're not really looking to God's word for those answers. And then I hear from pastors who talk about, like you said, there's so many women in our churches that have already gone through abortions. And I think that makes them fearful, but actually it's a great opportunity, great need, for pastors to be able to reach out and say, we love you, there's healing, there's forgiveness, and there are resources for you. How do people connect with the Charlotte Lozier Institute?
So our website is a great place to just search around, lozierinstitute.org. And again, you can email us as questions. If there's something you can't find, chances are it's there. We can find it for you, or we can write about it if we see that there's a need. But yeah, I'm excited for this opportunity to educate people because I think people really care for women. I think honestly, everybody in our country does care, but they don't know what true health care for women looks like.
Right. Well, it's such an issue for our day, and I
Mm-hmm.
hope people do connect with the Lozier Institute. I also highly recommend everyone connect with our 41 state organizations. We're part of the Family Policy Alliance, and so we have state organizations that are working for life to connect pro-life legislators. It's really a battle in the states, and primarily the state legislatures. So great opportunities for Christians to get involved and elect pro-life leaders who can then impact those state laws as well.
Yeah, absolutely.
And we hope everyone will join their local crisis pregnancy center, volunteer there, and get involved. So, Dr. Skop, thank you so much for all you're doing. Just grateful for your teaching, for your boldness. Thanks for being here today.
Thanks. It's been a pleasure. Appreciate
God
it.
bless.
Thank you so much for joining us for this incredible program today. We are so happy to be in your life. Have you shared this? Have you subscribed? Have you reviewed our podcast? Please share this with other people and help us get the word out that Christians are getting empowered around this nation. Step 1 to join Christians Engage is take our pledge to pray, vote, and engage on our website at christiansengage.org. Every week, we'll teach you how to pray for government. We will send voting reminders around every election, and we'll help you engage more for America. Step 2, take one of our classes. Have you taken our On-Ramp to Civic Engagement or Biblical Worldview or the Leadership of Nehemiah or Biblical Conduct? We have so many classes, including a full campaign school that you can plug into right now on our classes page. Step 3, hey, it's time to get involved in campaigns, advocacy, registering more Christian voters, activating your church. Every Christian needs to get off the sidelines and make a difference. We are here to mentor you into your place of leadership. That's what we do every day at Christians Engage. So reach out to us for help in any of those areas. And lastly, everybody listening to me right now can help fund a movement of millions of Christians that will pray, vote, and engage ongoing. We're supported by people just like you that every month or every year invest in this ministry, their hard-earned dollars, their treasure, their heart. We thank you so much. Please be a part and give at christiansengage.org. Thank you so much to our partners at The Stream. Thanks for sharing this podcast every week. We so appreciate you. Also, Edify app with Christian Post. Thank you for having us part of your podcast ministries. Christians Engage is a ministry of Family Policy Alliance Foundation, and together around the country, we are mobilizing Christians to pray, vote, and engage. We love you. We'll see you back next week.